Hello everybody, this video will explain the questions in the diagnostic test. Now you will notice that in diagnostic test we have a mix of different types of questions which we have covered in other videos. So we have got 10 questions in diagnostic test. So let's get started with question number one. The question number one says that the level of iron impurities in water sample is 2 milligrams per liter, and we have to express this concentration in terms of ppm. So if you recall from the other videos, I think the conversions, we looked at the different types of concentrations, how they are expressed, and then we also practiced converting from one concentration into the other. So this is the same type of a concentration. So this is the same type of a question where we have been given the concentration in milligrams per liter, and we have to express that in parts per million. So let's get started from the end, because that will give us an idea that what is it exactly we want. So parts per million, if you recall, parts per million is what I said that it's a smaller unit present in the bigger unit. We said it's 1 milligram in 1 liter. 1 parts per million is number of milligrams. So parts per million is 1 milligrams or 1 milliliter present in 1 liter, or 1 milligram or 1 milliliter present in 1 kg. So the smallest unit present in the bigger unit, that's how I remember it. So the second one is not applicable here, but this one is applicable because we are dealing with milligrams per liter. So parts per million, we have to find out how many milligrams actually, how many milligrams. Parts per million is how many milligrams are present in 1 liter, or how many milligrams are present in 1 kg. So we have to find out how many milligrams are present in 1 liter. That will be the ppm. Now if you look at the concentration which is given carefully, it's already given as milligrams per liter. So we know that 2 milligrams is present in 1 liter, and parts per million is the number of milligrams present in liter. So actually 2 milligram per liter is the same as 2 ppm. So that's the answer. Moving on to question number 2. The hospital has 1 liter pre-mixed bag of this is dextrose 5% and normal saline together. So sometimes in some infusions we have dextrose 5% and normal saline together, plus 20 milli equivalent of KCl. The patient's fluid has been running at the rate of 80 mils per hour for 8 hours. Now that's the infusion rate given and the time for how long that infusion has been running, and we have to work out the millimoles. Now one thing to note here is that the concentration of the solution is given in as milli equivalents, whereas we have to find out millimoles. Now if you recall from one of the other videos that for KCl and some other compounds where the valency is 1, for these compounds which have valency of 1, for milli equivalent is the same as millimole, right? Now which commonly used compounds have got the valency 1? There is another file I have uploaded which gives you an information about which commonly used compounds have got valency 1 and 2. So KCl is one of those compounds which have valency 1, and for these compounds milli equivalent is the same as millimole. So let's do this calculation bearing in mind milli equivalent, and then that will be the same in the end as the millimole. So we have a solution, a 1 liter solution. So 1 liter solution, and it has 20 milli equivalents of KCl. Now this patient has been receiving this infusion, 1 liter of which contain, don't worry about this one. So the patient has been receiving this fluid 1 liter as which has 20 milli equivalent of KCl at the rate of 80 mils per hour for 8 hours. for 8 hours, and we have to find out how many milliequivalents have gone into the patient at this rate for over 8 hours. So let's calculate how much fluid the patient has received first, and then from that we can calculate how much milliequivalent the patient has received. So if the patient received 80 mils per hour for 8 hours, in 8 hours the patient has received 640 mils. Okay, so now we know that how much fluid or infusion the patient has received. We can find out how much milliequivalent it was present in 640, and that would be the milliequivalent the patient has received. So 20 milliequivalent was present in 1 liter. Now 1 liter had 20 milliequivalents, but the patient has received only 640 mils per so far. So 640 mils will have, so it's this divided by this. Remember, it's milliliter here, so I would convert this 1 liter into 1000 mils as well. So that will be 20 divided by 1000 milliliters multiplied by 640 milliliters. That will be equal to 12.8 milliequivalents, or 12.8 millimoles. Sometimes in the questions, in the options, you might also have an option of 13. So just round it up to 13 because that's easier to deal with. So just a quick recap, we had been given the concentration, that how much milliequivalent was present in 1 liter, and we had to figure out first how much infusion the patient has received. We calculated that how much fluid the patient had received, and then we worked out how much milliequivalents were present in that fluid which the patient had received. So moving on to question number 3. It's a very easy question. What volume of 2.5% stock solution is required to prepare 2500 milliliter of 1 in 500 solution? So if you pay attention to the wording of this question, you will notice that we are required to prepare a solution for this, and the solution which we are required to prepare, we have been given the volume of that, and we have been given the concentration of that, and the starting solution from which we have to prepare, the concentration of that is given as well. So if simply we can apply C1V1 and C2V2 equation. But the problem here is that the concentration present on the both sides is in a different form. So let's convert the concentration on the both sides in the same form. So make sure that the concentration is the same on both sides. It would be easier to deal with percentage. So I will convert 1 in 500 into percentage as well. So the concentration on both sides of the equation will be in percentage. So let's see what is 1 in 500 in the form of percentage. So now in these types of concentration, you remember that I said before that it's like percentage. So basically 1 in 500 is equal to 1 gram in 500 mils. I'm converting that into percentage. So percentage is out of 100. So if 1 gram is present in 100 mil, I have to figure out how many grams will be present in 100 mils. So so the thing which I have to find out, I put it on the right side. So 500 mil has 1 grams. 100 mils will have 1 divided by 100 times 500. And that's 0.2 grams. So 0.2 grams is present in 100 mils, so that means the concentration is 0.2%. So 1 in 500 is equal to 0.2%. So I will plug this in the equation and everything will become clear. So that's equal to 200 milliliters, and that's the answer. So question number 4, a patient with atrial fibrillation needs to be given Amiodarone at the rate of 1 milligram per minute for 6 hours. So we have been given an infusion rate and the time of the infusion for the loading dose. You're asked to advise on what volume of amiodarone injection should be added to 500 ml of dextrose 5% to provide the required amiodarone dose. The amiodarone is to be administered by IV infusion. Now, first of all, there are quite a few things going on in this question. One thing is that we have been given the solution or the infusion solution in which the amiodarone would be present, and it's that solution, 500 mils of 5% dextrose. So this is just the solution. Don't consider it as numbers to be included in the calculation. So that, in other words, I'm saying just ignore this. Okay, so just consider it as a solution. Now the dose we have to give to the patient is 1 milligram per minute. Now don't get confused because the infusion rate is given. This is not a conversion of infusion rate from one form into the other. This is just the infusion rate is given and the infusion time is given. So we have to find out how much dose we need to add to the bag. So we have to give to the patient 1 milligram per minute for 6 hours, right? So let's calculate how much total dose we have to give to the patient for 6 hours. So 1 milligram per minute in 6 hours. How many minutes do we have? 60 minutes in 1 hour. So that means 60 times 6 is equal to 360 minutes. So I have to give the dose over 360 minutes, and the dose which I have to give is 1 milligram every minute. So if I have to give 1 milligram in every minute, in 360 minutes I will have to give 360 milligrams. Now the next question is that so how do I add this 360 milligram of dose to the infusion bag which I am preparing for this patient? So this 360 milligram of amiodarone will be added to this infusion bag which I'm preparing for this patient. As I said, the question is how do I add this 360 milligram to this infusion bag? I calculate this from the injection, amiodarone injection. So strength of the amiodarone injection is given, which is 150 milligram per 3 mils. So how many mils of this injection I will add to this infusion bag, which will provide 360 milligram of the dose. So let's take this concentration. 150 milligram is present in 3 mils, but I have to give to the patient 360 milligrams. So that will be 3 divided by 150 times 360, 7.2 mils. So that means I will take 7.2 mils of this amiodarone injection and will add to the infusion bag, which will provide 360 milligram dose to the patient over 6 hours. Let's have a look at question number 5. Here we have got a child weighing 10 kg and he has been diagnosed with pertussis. The doctor wishes to start oral erythromycin for 14 days. How many 200 ml bottles of erythromycin suspension will have to give? So one bottle of erythromycin has 200 milliliters, and the strength of that or concentration of that bottle is 500 milligram per ml. Would you dispense how much of that would you dispense to complete the antibiotic course for this patient if the child is 10 kg per dose 4 times a day for 14 days? So it's 10 milligram per kg per dose. So let's get that multiply that for the weight first. So it's 10 multiplied. So that's 10 multiplied by 10 kg because the weight of the patient is 10 kg. So that will be 100 milligrams of the dose, 100 milligram per dose. But we have to give it 100 milligram 4 times a day. So that's 4 times a day. So that means it will be 400 milligrams per day the patient will be receiving. And we have to give it for 14 days. So that will be, multiply that by 14. And that will be 5,600 milligrams for 14 days. So that's the total dose we have to give to the patient over 14 days, 5,600 milligram. Now from this 5,600 milligram, I can work out how many milliliters of the suspension I would give, and I calculate that from the strength of the suspension. So the strength of the suspension says 500 milligram is present in 1 mil, and we have to give 560 milligrams. That will be present in 1 divided by 500 times 560, and that turns out to be around about 1.12 mil, which is actually very less because there are like hypothetical numbers in this question. So over the 14 days we have to give the dose of 1.12 mils to the patient, and the bottle has 200 milliliters. So 200 milliliters are in one bottle, and over 14 days we have to give to this patient 1.12 mils. So quite obvious that we will dispense one bottle, and that's the answer. Moving on to question number 6. Here the question says that how many milliequivalents of KCl will be present in 5 milliliter dose of 10% weight by weight KCl elixir. In these type of calculations, I get tempted to start from the end. So 10% weight by weight KCl, that would be the solution, and this is the volume of the solution, and I have to find out how many milliequivalents will be present in that equation. So first of all, just write here the milliequivalent milliequivalent formula. That's milliequivalent is weight in milligrams divided by molecular weight. So, and times valency. But because as I said before, that KCl is one of those compounds for which valency is the 1, so for them you don't have to worry about this. Okay, so milliequivalent equation for KCl will remain the same as the millimole equation. So that's one thing. And now start from the end. We have 10% weight by weight volume, which means 10 grams in 100 mils. But I have 5 mils of the solution, so I will find out how much I have, what number of grams or milligrams I have in 5 mils. Because I know that in the equation it would be milligrams required, so I will just convert this into milligrams right here. That's 10 grams, so that will become 10,000 milligrams in 100 mils. So I know from this 10% weight by volume that 100 mil has 10,000 milligrams. So 5 mils will have, because I have to find out in 5 mils, so I have 5 mils will have, now remember I'm trying to find out the milligrams, so I put it on the right side, and it will be this divided by this multiplied by 5. So that means 5 mils, which I have these 5 mils, this 5 mil has 500 milligrams. Now I have from this concentration, so far from this concentration I have worked out how many milligrams will be present in this 5 mils. Now once I know that how many milligrams are present in that 5 mil, I can work out how many millimoles are present by using this equation. So coming back to this equation, we plug the values in. Milliequivalents I have to find out, weight in milligrams I have been, and molecular weight of KCl, which is actually not given here, it's 74.5. Remember, the molecular weight is actually not given. Usually in the questions, in SPLE questions, it will be given, but KCl is very commonly used, so you should know the 74.5 is the molecular weight of KCl. So just calculate this, and it turns out to be 6.71, and we can round it up to 7 milliequivalents. That's the answer. Question number 7. Here, a 2-month-old full-term baby weighs 5 kg and she has been prescribed augmentin at the dose of 30 milligrams per kg per day, divided every 12 hours orally. What volume of augmentin 125 suspension will be required to dispense each dose? So the concentration of the augmentin suspension is given, and we have to work out the dose for the patient, and then we have to find out how many mils will be required for each dose. So let's start with the dose first. 30 milligrams per kg per day, and it's every 12, divided over 12 hours, divided every 12 hours. So 30 patient weight is 5 kg, so 30 times 5 is 150 milligrams per day, and that has to be divided over 12 hours. So we have to give 150 milligrams every divided over 10 per day, divided every 12 hours. So when you are given a dose which says 150 milligram divided every 12 hours, so that means you have to half that dose if you're trying to find out a single dose. So I have calculated 150 milligram total daily dose, and it has to be divided over 12 hours. So that means each single dose will be 75 milligram, and I will give 75 milligram twice a day. So now I have worked out how many milligrams I have to give for each single dose, and I can convert that into milliliters now from the strength of the suspension. So I know from the strength of the suspension that 125 milligram is present in 5 mils. So 75 milligrams will be present in 3 mils, and so that's the volume of the augmentin suspension I need for each single dose. So that's the answer. 3 mils is the answer. Moving on to question number 8. Here we have to calculate the volume of 10% weight by volume, which is required to prepare 1 liter of sodium chloride solution, which containing 0.2% weight by volume of potassium chloride. So if you again pay attention to this question, we are required to prepare 1 liter of the solution. So this is just the solution, so just ignore this number. So we are required to prepare 1 liter of the solution, which should contain 0.2% potassium chloride, and starting solution is 10% weight by volume of potassium chloride. So it's simply C1 V1 C2 V2 equation again. Our starting solution is 10%. Volume of that we have to find out. Concentration has been given 0.2%, and volume is given as well, is 1 liter. Okay, again, you can see in C1 V1 C2 V2 equation the concentration on both the sides is the same, so it's a fairly straightforward calculation. So that turns out to be 0.02 liters, and if you want to convert that into milliliters, it will be remember that liter is a bigger unit, so I'm going from a bigger unit to a smaller unit, and the decimal will move towards right by 3 places, so that's 1, 2, 3, and that will become 20 milliliters. So that's the answer. Question number 9 here. The patient has been. We have to give to the patient 400 milligrams ciprofloxacin dose over 1 hour as an IV infusion, and the IV infusion concentration is 2 milligrams. So what rate of infusion should we set? So here we have been given how much dose we have to give to the patient over what time, and we have been given the concentration of the infusion, and we are asked to find out what infusion rate we should set so that the patient gets the required dose in over 1 hour. So let's start with the dose which we have to give to the patient. So we have to give 400 milligrams over 60 minutes, over 1 hour. Now, if you look at the final infusion rate, which I have to work out, is in mils per minute. So it would be much easier if I start converting the units right over here. So 400 milligram will be in 1 hour. That means 400 milligrams in 60 minutes. Right now, in the end, I want mils per minute. So I've got the minutes here. There's 400 milligrams. So the next thing will be how many milliliters are present in this 400 milligrams. And then I can figure out mils per minute. So how many mils are present in this 400 milligrams? You make use of this information, which is the concentration. So I will use the concentration of the infusion, which is given, to figure out how many mils are present in 400 milligrams. So let's do that here now. So 2 milligrams present in 1 mil, that's the concentration of the infusion, but I have to give 400 milligrams. So 400 milligrams will be present in how many mils? In 200 mils. So that means I have to give 200 mils in 60 minutes. And in the end, we have to work out mils per minute. So that will be simply be 2 mils divided by minutes. So that will give me a number of mils per minute. 3.33, or we can round it up to 4 mils per minute. Okay, moving on to the last question of the diagnostic test, which is about calculating loading dose for drug X in milligrams, given that the doctor wants to obtain the plasma concentration of 2 mcg per liter, volume of distribution is given, and oral bioavailability is given. Now, as I said before, that you need to remember loading dose, which is loading dose target plasma concentration times volume of distribution divided by Solve factor multiplied by bioavailability. So the target plasma concentration which we have to achieve is 2 mcg per liter, 2 mcg per liter, and volume of distribution is already given, so we just plug it in the equation. It's 350 liters. So as I said before, that in loading dose we have to, and also in the maintenance dose equation, we have to write the units for the plasma concentration because that's important. So Solve factor is not given here, so we assume that it is 1, and bioavailability is given, which is 0.7. So here liter will cancel the liter, and we will get the final loading dose in mcg. So that will give me 1000 mcg, and I have to find out the answer in milligrams. So 1000 mcg is simply 1 milligram, and that is the answer.